October is Breast Cancer Awareness Month, and there are some important things we need to know for prevention and detection. Here to share with us some helpful tips that could save your life, welcome back, Dr. Mayberry. Good evening.
Good evening. Thanks for having me.
Yeah, thanks for being with us again. So we were talking about this a little bit this morning, and you were saying that this problem is so widespread and prevalent, even more so than I even knew.
Well, and that's some of the information that I want to get out there, is that women need to know that 1 in 7 women will get a breast cancer in their lifetime.
And you're talking about women who didn't necessarily have this in their family and didn't have any cancer problems themselves, just the fact that you're a woman, you could get it 1 in 7, correct?
That is correct. That's what we talked about this morning a little bit, which is the fact that the majority of women who develop breast cancer, over 70%, have no family history.
Talk to me a little bit about screening and why it's so important to have a mammogram, and talk to us a little bit about the confusion over at what age to do that.
Right. And okay, so that's one of the other things that I think is really important to get the news out there, and that is that we still recommend screening mammography to begin at age 40. We recommend annual mammograms, and that is going to continue throughout the woman's lifetime.
And some people have thought that things changed and the new age was 50, but you're saying for sure it is at 40 years old women should be doing this.
There was at one time a recommendation that came out from a government study that suggested we begin at age 50 and do it every other year. But the American College of Radiology currently recommends screening mammography to begin at age 40 on an annual basis.
And we're not just being dramatic when we say this could save a life. Tell me how important it is that you get that early detection.
Well, so the reason for early detection is that the smaller the cancer, the less likely it is to have become metastatic to the lymph nodes, the easier it is to treat it with surgery. You can imagine if you can feel a cancer that's 1 centimeter in size, that's about ½ an inch in size. If you can feel it then, but I can find it when it's 4 millimeters, which is less than ½ an inch, that's a big difference. And so the survivorship is greater when you find them earlier.
Okay, unfortunately, we're flat out of time. Such important information. We'd love to have you back another time. And people can also find you at San Diego Imaging. Thank you so much, Dr. Mayberry, for being with us.
Thank you.
All right, we'll send it back to you at the desk.